Good afternoon. I'm Terrie Strebing. I work at Pekin Insurance Company. I work for the TPA division. It's called Group Plan Solutions, and TPA means Third Party Administrator. We're a part of the organization in the Life Claims division. And life claims at Pekin Insurance, if you don't know this, has been paying claims for more than 40 years, health claims. So got a lot of experience, a lot of infrastructure, and are able to move that to a different level on the TPA side or third-party administration self-funded plan. You're able to add flexibility through self-funding. There aren't as many state mandates, federal mandates guide the self-funded side of it, so we're able to react quickly. We're able to be flexible and to match benefits for employer groups, which a lot of times are important to school districts because you have some unique requirements or negotiated benefits. And then we have self-funded claims administration for not only a medical plan, dental, vision, short-term disability. We do flex, we do HRAs. So we're a full-service TPA right down the street here in Pekin, Illinois. And we're a part of Pekin Insurance. So even though you hear Group Plan Solution, I want to make sure you know who we are with and what we're doing. Just a brief overview. Chris kind of took a temperature of the room. How many people are fully insured, self-funded? Seems like it's maybe half and half, maybe a little more towards self-funded or third-party administration. So what is self-funding? It's your health plan or medical benefits can be put onto a platform called self-funding that allows you to be a little more creative with your design and react a little quicker to the industry or what's happening in your area. You might have on the fully insured side limited plans that you can pick. You know, they have quite an array, but they may not match what you need exactly. So we can kind of insert those types of benefits in, and then in the process of doing that, we're able to give you a lot of data or information. I'm going to talk a little bit more about why that's important. And it helps you make decisions about your plan, your money, and how you want to move forward, rather than just waiting for your annual renewal to find out what's my budget going to be next year. You can be a part of that solution. The health and wellness piece of it comes into play because when you self-fund your benefits, most health plans in the United States are self-funded. More than 63%, it has increased up to 63% over the last few years. The Affordable Care Act has been a very good guide to self-funding for the overall employer states because of the ability to be flexible, to move the benefits to what match yours and the requirements and regs that are out there. But on self-funding, it is when the employer pays the employee's claims out of their own funds. And I know that sounds, you know, oh, wait, we can't control claims. What you do on top of that is with that funding arrangement, you purchase stop loss from a reinsurer for that catastrophic amount that may go over what you have in your funding account or you have budgeted for. So we are able to shop with multiple stop loss carriers when we do that marketing for you. When you come to Group Plan Solutions for a proposal, we're able to get maybe 4 or 5 different quotes from different carriers. So you have an option there to look at. So I want that to be the theme. I want you to understand we're flexible, you have options with us, you're able to pick solutions that work best for you. And so that money that is paid toward the claims, when you set up your health fund, about 30% of the cost of your health plan is fixed costs. That's your administrative cost, that's your stop loss protection, that is some of the ancillaries if you're purchasing a network access or pre-certification services. But the other 70% are claims. That 70% in the long run is your money. And when you couple it with a good health and wellness program and you manage your plan well, that is your fund to take care of your health benefits for the future. It's a long-term plan. The more you watch over it, the more you take care of the plan design that you have, and the more benefits that you put in there, such as health and wellness, that fund is yours to manage and take to year to year to year. So you've got your catastrophic coverage and your reinsurance there. You've got your great plan design. You've got your wellness and information all put together, and that helps you make better decisions in the long run for your health plan. So this is just a little picture of what I was talking about. On a fully insured plan, you've got your administration costs, your claims adjudication, your premium taxes, your risk pooling, and your general expenses. Over here are the claims for your medical reserves for the first year. All of that goes together, and if you do a good job managing, you have a great year, guess where that extra money goes? That fund goes to the profits to the carrier. In the self-funding model, you have your TPA, we're going to do the administration. You're going to get ID cards, you're going to get EOBs. It's going to look just like a regular insurance plan. It's not a lot different other than the service that you get behind it. You have your administrative costs, you have your stop loss costs for that catastrophic event, that's the spec and the ag, and then you have your claims expense. But if you have any of those, that fund for your claims left over, you've had a great year, you've managed your expenses, that potential savings remains in your fund for you to use to either improve your health benefits to your employees or to carry over for the next year so that you can maintain a level premium to the employees over the long run. So Bill asked that I bring this all together with the health and wellness piece of it, and so this is so important to a self-funded plan because you want to maintain healthy individuals in your plan because that means more money remains in your claim account. So you usually see the benefits of a health and wellness plan a lot quicker on a self-funded basis because you've got healthy people. A lot of the slides I have would have been similar to what Chris had presented because what you want to do is manage the health of your employees or dependents that are on the plan. Keeping people healthy is important. It's not just focusing on those individuals that are in that risk pool. You obviously want to keep them healthy because the old rule still applies. 20% of your population has 80% of your claims. The sick individuals are those with catastrophic diseases. But you want to keep the healthy people healthy so that you keep that fund at a level amount. You don't want people moving from healthy to sick. You want them moving from sick to healthy. So when you do that, you need a lot of information, as Chris was talking about, to manage that. So as a TPA, what we do is we get a lot of information from you. We have your census information, the date of birth, everybody that is on your plan is in our system, and we're able to pull that information out. The next thing is we get your claims in. We pay those claims. All those codes, ICD-10s and diagnosis codes and information go into our system. We send information to maybe your pharmacy benefit manager for your eligibility. We have that information. So we gather all of that information that we are receiving in on a daily basis and put it into files, formats, or as some of the vendors need like FTP site transfers. They need certain data for your wellness that Chris was talking about. We gather that information and then we put it into the format that they need to use to get what you need out of that, whether it be a wellness program, whether it be your benefit, your pharmacy benefits, whether it be your network. Because when you go and show your card, you want them to know that you're in that network. You want them to know that you have a prescription drug. So a lot of what we do behind the scenes is gather the information, format the information, put it into a category or a file or a transfer that they can use. So that's how we coordinate and why self-funding works so well with health and wellness benefits. And we're kind of helping you see the future. We can't tell you what your claims are going to be forever, but we can help you see what's coming down the road with all the data and information we provide to those vendors. So, any questions? Yeah.
What do you typically see as far as size of group? I know years ago it used to be over 100, and now that's really diminished with the advent of some of the health regulations.
It has. The reinsurance carriers have kind of responded to that because the ACA has driven a lot of business to the self-funded world. Group Plan Solution goes down to 25 employees on the plan. We have stop-loss vendors that will cover that amount. So depending on your situation, that's where we like to start at 25 and up. We don't have a limit, so if you got more than that, we're happy to take them.